The Healthcare Labyrinth Podcast is back for another episode. Join Marc S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth Podcast, where we navigate the maze of healthcare policy and economics each week. My name is Marc Ryan, and thanks to everyone for listening in. For decades, almost every major player in healthcare has taken a big hit from payment reform, except one. So we are covering today the fact that hospital price reform may be mounting, and it could be a Washington earthquake. We will take our regular 3 breaks, so let's get right into it. So part 1, the setup. Who has escaped reform? Health plans have been hammered by minimum medical loss ratio rules, with their margins capped, and thus profits have been scrutinized. What about primary care doctors? They have been quietly squeezed for years. Real income has been declining when adjusted for inflation for decades. Burnout has been rising. Fewer have chosen the field, and more are selling out to big corporate entities, health systems, health plans, and private equity firms. But hospitals, they've been pretty much exempted. Not untouched, but largely protected. There's a reason for that. Hospitals have built one of the most powerful lobbying machines in Washington. Bipartisan, deeply entrenched, highly effective. For years, that shield has worked. Even as healthcare spending exploded, now topping $5 trillion annually in the United States, hospitals have largely avoided the kind of structural payment reform imposed on others. And here's the key stat that should stop you in your tracks. Roughly 1/3 of all healthcare spending, over $1.5 trillion a year, goes to hospital care alone. That's not just a big slice of the pie, that is the pie. Now layer on this. Since 2000, hospital prices have risen 3 times faster than inflation and about 2 times faster than wage growth. So while Americans feel squeezed by premiums, deductibles, and taxes, hospital pricing has been accelerating far beyond the economy itself. And yet, until now, serious reform pressure? Minimal. But something is changing, and fast. With that intro to our topic, we'll take our first break. Be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Marc Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Marc dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Marc is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Marc's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back to the Healthcare Labyrinth Podcast. I'm Marc Ryan, and thanks for listening into this episode. We hope you're enjoying it. Today, we are talking about the likelihood that hospitals may finally see reform to their prices and how they are set for 1/3 of healthcare. So let's get to part 2, the shift. Why hospitals are now in the crosshairs. A major signal just came out of Washington. And if you follow healthcare policy closely, you know how rare this is. A think tank called the Paragon Health Institute, which has growing influence in both Congress and the administration, released a hard-hitting white paper on hospital cost. That wasn't subtle. It directly challenged one of the most protected narratives in healthcare, that hospitals need higher payments to survive. Paragon argues something very different. Hospitals can operate profitably at Medicare rates. Many already do, especially efficient systems. And government policies themselves are inflating hospital prices artificially. That last point is critical. because it reframes the issue. This isn't just healthcare is expensive, it's the system is designed in a way that makes hospitals expensive. And Paragon isn't alone. Even traditionally measured voices are starting to say the same thing. A major feature in The Economist, my favorite news magazine, earlier this year laid it out bluntly. Americans are blaming the wrong players, not insurers, not drug companies. Hospitals are the real culprits. Why? 3 core reasons. 1, fee-for-service still dominates hospital payments. Despite years of talk about value-based care and some reforms, hospitals still largely operate on a fee-for-service model. That means more services equals more revenue, not better outcomes equals more revenue. It's volume, not value. Number 2, prices are opaque. Even today, despite transparency rules, patients can't easily compare hospital prices. Employers can't predict costs. Even insurers struggle with variation. The same procedure can cost 2, 3, even 5 times more, depending on the hospital. Same service, same outcome, wildly different prices. Number 3, consolidation has changed the game. Between 2000 and 2020, over 1,600 hospital mergers and consolidations occurred. Today, chains control 81% of hospital beds. In many cities, 1 to 2 systems dominate the entire market. And when hospitals consolidate, prices go up, not down. And here's the uncomfortable truth. Quality doesn't consistently improve. It may even go down. So what we've built is a system where bigger hospitals equal stronger negotiating power. Stronger negotiating power equals higher prices. Higher prices equals higher premiums. And the cycle continues. With that, we'll take our second break. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back to the Healthcare Labyrinth Podcast. I am Marc Ryan, and thanks for listening in to this episode. We hope you are enjoying it. Today, we are talking about the likelihood that hospitals may finally see reform to how prices are set for 1/3 of healthcare. So let's get to part 3, the policy earthquake, site-neutral payments. Now we get to the part that could actually change everything. There's a concept that has been floating around policy circles for years. Site-neutral payments. It sounds technical, but it's actually very simple. It means the same service should be paid the same amount no matter where it's performed. Right now, that's not how it works. An example, a basic procedure in a physician office equals a lower payment. The exact same procedure in a hospital outpatient department, much higher payment. Why? Because hospitals can charge facility fees and have been grandfathered in at much higher fees in general. Not because the service is better, not because outcomes are better, just because of where it happens. And hospitals have defended this aggressively. For years, site neutrality was a non-starter until now. In a recent Capitol Hill hearing, something remarkable happened in my view. Hospital CEOs signaled they are open to discussing site-neutral payments. That is a watershed moment. Let me repeat that. In over 30 years of healthcare policy battles, this level of openness from hospital leadership is almost unheard of. Now, this wasn't a surrender by any means. They want gradual phase-ins, adjustments for complex cases, protection for financially vulnerable hospitals. And to be fair, that's not unreasonable. I've been on 2 hospital boards in the past. I understand what they do and the unique burdens they shoulder: emergency care, trauma services, uncompensated care, teaching responsibilities, driving the training of future doctors. But here's the tension. Those realities have turned into a blanket justification for higher prices across the board. And that's where the system has gone off track. Because over time, hospitals have become, and this is the hard truth, an entitled class within healthcare, protected, insulated, and often unaccountable on cost efficiency. Now, a bigger idea: price standardization. Now, let's push this even further. What if we didn't just fix site of service differences? What if we address the core distortion: commercial prices being wildly higher than Medicare and driving up commercial insurance costs and premiums? Right now, commercial plans often pay 150% to 300% of Medicare rates, sometimes even more in concentrated markets. Hospitals argue they need that to offset Medicare and Medicaid. But multiple analyses, including work from Third Way, suggest efficient hospitals can make money on government rates alone. If that's true, then the entire pricing structure is upside down, and fixing it could lower employer premiums, stabilize coverage, reduce national healthcare spending dramatically. This is the kind of structural reform that hasn't been seriously attempted, but now it's being talked about. With that, we'll take our 3rd break. Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Marc Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Marc's insights. Twice a week, Marc publishes a blog to go deep into a current issue. And of course, Marc hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Marc's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back to the Healthcare Labyrinth Podcast. I am Marc Ryan, and thanks for listening in to this episode. We hope you're enjoying it. Today, we are talking about the likelihood that hospitals may finally see reform to how prices are set for 1/3 of healthcare. So let's get to part 4, the reality check: reform versus consequences. Now, before we declare a revolution, let's ground this, because there's a complication, actually a big one. At the same time all this reform momentum is building on hospitals, Washington is also pulling money out of the system. The One Big Beautiful Bill Act is expected to reduce healthcare funding by over $1 trillion across Medicaid and the exchanges over 10 years. That's not abstract. That money flows through health plans down to hospitals and providers, and ultimately impacting patient care. So what happens if you do both at once? Cut funding and cut hospital prices. You risk real disruption. I'm not immune to that reality. Hospitals, especially rural hospitals, safety net systems, high Medicaid providers, could face serious financial strain. So here's the balancing act. Yes, we need efficiency and have to start moving on that. Yes, we need price reform. But we cannot ignore access stability and real-world consequences. Now, my final thoughts. Is this a turning point? So where does this leave us? For the first time in years, maybe decades, influential policy voices are targeting hospital pricing. Lawmakers are engaging seriously. Hospital leaders are showing some willingness to bend. That combination is rare, but don't underestimate the resistance from hospitals. Hospitals remain one of the most powerful lobbying forces in Washington. They've stopped reform before, they can do it again. Still, something feels different this time. Because the system itself is under pressure, employers can't absorb rising costs, consumers are maxed out, government budgets are strained. And when all three converge, reform becomes inevitable. The real question isn't whether hospital pricing will change, it's how far Washington is willing to go, and whether we can finally fix costs without breaking the system in the process. That's it for today's episode of the Healthcare Labyrinth Podcast. Thanks for listening. If you enjoyed today's episode, be sure to subscribe and share it with colleagues interested in healthcare policy. Until next time, stay curious, stay skeptical, and keep navigating the healthcare labyrinth with me. We will find our way out together. Again, I am Marc Ryan. This is the Healthcare Labyrinth Podcast. See you next week. Take care.
Thanks for joining Marc and the Healthcare Labyrinth Podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth Podcast.